for all the. Ah, there you go.
I'm gonna switch my video off.
Okay, you can go, Denis.
Okay, so maybe until everyone is here, just a very quick history of the shockwave. So the shockwave came from the lithotripting technology initially, and the development of the cavitation theory. Because, as you know, the lithotripter, which is designed to dislocate the stones in the kidneys and in the ureterary pipe, it's exactly the same technology, in fact. So it's just about to launch a wave, and this wave will create a cavitation phenomenon, and this cavitation phenomenon will modify the local chemistry and organize a complete, a very deep and complete change in this cellular environment. And this is, and the side effect of this cavitation is damage, in fact. So this is what happens in boating industry, because when the propel turns, it creates the same cavitation phenomenon. And this cavitation used to destroy, in fact, the propel. These bubbles created, when they implode, when they collapse, they had a damaging effect, and they were damaging the propel of the boats and submarines, in fact. So this is exactly the same phenomenon. So we use in medicine this cavitation phenomenon to modify the cellular environment, and to use these damaging properties when we need them. So for kidneys, of course, for stones in kidneys, but as that led to create a shockwave to use in the for musculoskeletal purposes. So that is the history. And to complete this little history, when I was working in France in the early 90s, in this rehabilitation center where we were dealing only with sport people, so we had permanently 125 sport people aged 25. So we were the ideal experimentation area for manufacturer of new technologies. And one day, a manufacturer called EMS, which is still on the market, they came with a very rudimentary piece of technique and to deliver shockwave. So we had a compressor, and we have a little gun with and it was about to hit tendons to see if we could have effects on inflammations. So we started to use that on our patients, because when we were dealing with lots of ACL rupture, and then after there was at the time there was lots of Kenneth Jones, if you remember this technique, which is still used, but taking the patellar tendon as a graft in the following days after during the rehabilitation time. Some patients were developing patellar tendinitis. So we were using this revolutionary rudimentary machine to hit their patellar tendon and see what we could do with that. And so we had this machine for a few weeks and a few months. And then we noticed that by hitting the tendon, we were able to get rid of tendinitis for our patients. So it was a little bit of a discovery for us. So we design by using them regularly with all these people. We design the starting programs for the manufacturer to start selling these products. So this is the history of the little history of this technology. So as I say, so the definition we can say of this shockwave technology is a mechanic treatment which generates wave through the tissue's percussions. These waves can penetrate up to 3-4 centimeters, which is in inches. I did the research, 1.2, 1.6 inches within the tissue. The effect that we are looking for is, in fact, to generate micro injuries in the tendon, because if we want to make a definition of a tendon inflammation, we can say that it is a healing process which in fact never ends. It's a healing process. The tendon gets swollen, gets hypervascularized, and sometimes it never ends. So by hitting the tendon and creating a micro injury on the tendon, we are launching a new healing process, which we know this one will have an end. And this is the principle of this treatment. So because of this process, we can say that the maximal effect we will have by starting a shockwave treatment will be up to 6 to 8 weeks after the last session. So even if you don't get an immediate result, which you will get some very interesting result very quickly. Sometimes it's even spectacular. You can have a very good result after only one session. But if you don't have a good result after 3 or 4 sessions, it doesn't mean the process is not on its way, and the maximal effect of your treatment will take place 6 to 8 weeks after your last session. So this is usually what you need to expect. As I said, the cavitation, I will not go through the fluid mechanisms, but the cavitation will in fact modify deeply the chemical environment, will increase drastically the local cellular activity and the local blood flow. That will break the local fibrosis, which takes place especially on chronic tendonitis, and will create a local analgesia. This is what happens. What are the contraindication of this technique? So obviously, because of this fluid perturbation that we create, we don't want to use that during pregnancies. We don't want to do that in presence of coagulation disorders, people who have hemophilia, but that can be people who are under strong anticoagulants as well, because we don't want this technique to free a clot, obviously. Other contraindications are tumors and all neoplastic tissues. Thrombosis, as I said, thrombosis and I will say arterial obstructions, people with high cholesterol, so with serious disorders in their arteries. Systemic or local infections are a contraindication too. The polyneuropathies, as for example in diabetes, for example, when it's associated with sensory disturbances. Corticosteroid, so that's pretty important because it means that you will not do any shockwave therapy immediately after a corticosteroid injection. You will need to wait a good 6 weeks after any injection on the site. Obviously, on growth plates on children, you must not hit the growth plates. You must not hit directly prostheses, but obviously you can do that at distance of them. When people have serious heart conditions like stents or heart valves replacements, pacemaker, so obviously at distance, we are talking. You can if someone who has a pacemaker has a patellar tendonitis, you can do that, of course, but not if it is a pectoralis major tendonitis, for example. Superficial metal work from a surgeon. You don't do that directly on that. Any gynecological conditions, you don't hit any reproductive organs. Just the thought of it hurts me. And nothing close to the eyes. So that's the contraindication. And now the indications. So the main indications, obviously, as you know, are all the insertional tendinopathies. It's an excellent indication as well as the tendon calcifications. Same mechanism as the stones we were talking about for kidney stones. Bursitis is a good indication too. Very good result in plantar fasciitis, with or without heel spur. All kind of fibrosis, and I'm thinking especially on when you have, as you know, the nature is very generous, and sometimes too much generous. And when you have a muscle injury in the middle of the bulk of the muscle, sometimes you end up with a big scar, painful scar sometimes. So that's a good indication for this produced scar tissue. Periostitis, and of course we think immediately about shin splints. Very good indication. And I was using that quite a lot with muscle spasms on trigger points, on painful trigger points. That works well. And you have specific programs in the machine already in place. Something that I have never really explored, first because as you will see, using the machine and hitting the bones each time, and I'm specifically thinking about epicondylitis, the tennis elbow, for example. Be careful when I'm just thinking about that because it's quite easy to hit the epicondyle where the muscle attached. And if you hit too much the epicondyle, you can end up with an hematoma on your epicondyle, and it's not very nice and it's very painful. So I have always been a bit reluctant to hit directly the bone, but some people say that it's an excellent technique to promote osteogenesis, which on stress fracture, for example. Apparently it works well on stress fracture, but this is something I've not really the experience about. So you can explore that if you want, but apparently it's a good indication too. What can we say is what are the possible side effects you can get from time to time? So the immediate side effect is the pain. It's usually a bit of a painful technique, especially at the very beginning when you hit an inflamed tendon. People will be in pain. So that's why on the machine you have on this particular machine you have a feature which is interesting, which is called the ramp. So the ramp in all the programs which are already set up, the ramp allows you to go progressively to the preset intensity in bar, and not hitting the tendon straight away with the big intensity. So that's something, especially with people who are a little bit sensitive, and everyone, you will see that everyone reacts a little bit differently. Some people will be very easy with it, and we will ask for more. But usually people are a bit sensitive to the technique, so the ramp feature is a good feature. So the the side effect that you can face possibly in the next 1-2 days can be an increase, a temporary increase of pain, on the local pain. So you need to reassure the patients. Usually that can last 1 to 3 days after the session, but it's possible, especially after the first one. Reddening of the skin, obviously, but this usually disappears very quickly. A bit of swelling can happen as well. If you hit a bony structure around, you can have an hematoma, or an hematoma from the skin, obviously. What else? Some red spots can appear after a session too, but all of this should be gone in within a few days or a week after your session. If you get this kind of side effects, obviously you shouldn't plan your session with this still active side effects. That is why usually it's good to make a space of 1 week between sessions, and usually that allows to the local area to recover. Okay, so that's what I wanted to tell you about the machine itself. To me, what is important to remember, first, when I forgot to tell you, but James, but when you put the compressor on, just before the treatment start, as you have seen, it generates lots of vibrations and noise. So it's not very nice. So during the transportation, I have lost a little bit of a little piece around the machine. So usually I put a little bit of a cardboard and to stick you need to find out how to limit the vibration of it's alongside the ring. There is a ring alongside the machine, and this ring vibrates quite a lot. So you again just put a little piece of paper or cardboard, and that will limit the noise of the vibration. Then the machine itself is for those who have already used it or explore it. It's really straightforward. You have, when you put when you are on the home page, you have on the left side you have the quick links, they call, which puts you directly on the most common program that you will use on the machine. Then you have underneath the clinical protocols, which I was using a lot, because on these clinical protocols you have a display of the human body, and on each part you have a little points. You press on the little points you are interested in, and you will get all the pre-set up programs. If you press on the knee, for example, you will have all the preset program for knee jumpers, knee runners, for all the little issues that you can find in this area. If you press foot, you will have plantar fasciitis, you will have without heel spurs, which are different programs. On the elbow, you will have epicondylitis, you will have lateral epicondylitis and medial epicondylitis. On shoulders, you will have all the rotator cuff tendons, calcifications. So it's very interesting to for each program, which are set up for each pathologies. You will have two programs. You will have, for example, for lateral epicondylitis, you will have lateral epicondylitis number 1 and lateral epicondylitis number 2. So not a big difference between the two level of programs. As you can imagine, the level 1 is when people are very sensitive, so mainly for people who have experience whose condition are pretty recent. And the program 2 will be for more chronic condition. The pain is a factor. Obviously, people who are very much in pain, you will try a program 1 and then a program 2. But even within the program, you can, if you see that you are on program 1 and everything is fine, because usually it's very painful for the first 30 seconds, and this is the effect of the technique, people don't feel anything anymore very quickly. So you can manually increase your intensity, not too much. I would not, don't get crazy with the bar. So for example, if you have a setup of two bars, don't jump to 5 bars, which is the max, I think, just because your patient can handle it, because that's a big change. You can play within, let's say, a 0.5, maximum 1 bar, when people are really easy with the technique, but don't jump from 2 bars to 4 bars or even 3 bars too quickly. Be very progressive on that. And then you can play as well with but you will see with all the tendinitis, either you are on program 1 or program 2, the frequency, which is the tac 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 speed, as if we can say that, it's always, except for fingers. You know, I was thinking about de Quervain syndrome, where it's more 10 or 12, I don't remember exactly, but usually for all the tendon problems, the frequency is around 15. So a good way to play with is to decrease a little bit this frequency. You will see that decreasing the frequency makes it more difficult to cope with. It's more painful. So I would say, if people are really easy with the technique, either on program 1 and program 2, play a little bit on 0 point something with the bar and get down with 1 or 2 in frequency. The principle being that you need to do at the limit what the patients can cope with. Staying in these limits, in these reasonable limits that I was talking about, of course. What else can I say? again, very the machine is very intuitive. The display is very nicely done. So just explore it and go through the pages, and you will see the amount of preset programs you have is pretty amazing. And do not misestimate the use of the muscular program. If you have, for example, to get back on this lateral epicondylitis, usually you have the pain on the tendon attachment, obviously, but you can have a reactional muscle spasm in the forearm. It's quite common. So you can use which make me think something important to speak about is the emitter. You have two emitter. So usually when you set up the program, you have two emitters. One is called R15, R like Richard, 15. And the other one is called D. Yeah, I think I remember well. It's called D like Denis, 20. So you will see that for most in your program, you will see which piece to use, which is the most appropriate to use according to the program you are using. It's always written. So usually for the tendons, it's the R15, and for all the muscle spasm, the reactional muscle spasms, it's usually the D20, because it's more a spread effect. And when you do this alongside a muscle spasm, this is what you are looking for, a spread effect of the shock waves, vibration almost, and which make me think as well. An interesting feature maybe for you to buy, James, is what because there are two channels on the machines, channel 1 and channel 2. I have only used the channel 1 because you can do all the programs I was talking about, but you can, for example, use the channel 2 and put what we call the vibration actor, V actor, they call that, which allows you to do a proper massage. So it's for lower back problem, for example, it could be nice if you want to do the most of the machine to add this feature. You just had to buy this little additional piece, and you will have a very complete machine.
Cool. Denis, ça va couper. It's
Okay.
gonna, guys, I'm gonna resend an invite as soon as I'm allowed on your email, and we go back in like 5-10 minutes.
Okay.
See you in a bit.
Yeah.